Tim is a 20-year-old patient attending your clinic with his mother. She informs you that Tim was stick on his face with a hockey stick about 30 minutes ago, and if he wasn't ready, his mouth flat. He then used his functions and he was not positive. You examined the film and found that one is the space patently, two is extraction that did not tinty without pan exposure. His lip also has a small cut due to the trauma. Vitality test release that one is unresponsive, two is painful, with a low latency response. You accept that Tim is cooperative and necessary physically examined. Address the patient's concerns, explain what has happened, and use short-term and long-term narration.
The pointers here would be that we approach the situation with empathy. We also reiterate the incident in a quick recap. We also must strategize each step logically based on the urgency of the situation. Let's dive into the role play now. Hello, Miss Smith. It's really good that you've come quite early within the period that this incident has happened. How's Tim feeling right now?
I think he's in a bit of pain and he's quite shocked with the blow on his face. But yes, we didn't want to come in quite immediately so that, I was a bit scared. Didn't see this actually.
Yeah, absolutely. I just want a quick recap of the incident again. As I understand, this was a hockey incident. What actually happened?
He was at his general moment at Princeton. He was playing and, I was just sitting by when I realized that he got hit. So he just came into the
All right. So did he fall on the floor with his face forward, or did something hit he in the face?
The hockey stick hit him when he fell down. Actually on his face.
Right. I also noticed that he wasn't wearing a mouth guard. Is that right?
Yes, he has a mouth guard that was specially made for him, but this was just a practice verb, so
Okay. So does he wear it regularly?
he wears it for his matches then compulsory.
All right. Yeah.
Practice. I have to ask.
Right, yeah, it is quite important in future that he wears it regularly, regardless of whether it is a practice session or a main game, because we don't want these incidents to happen again. So I also note that he did not lose any consciousness and did not have any vomiting as well.
No, yeah, he was just he fell down and then he went up and still was like shock.
Yeah.
He walked the curve away and
Okay, that's pretty good. That's assuring actually. Also just wanting to double check, does he have any medical problems, medications that he's currently on?
perfect child.
Okay, that's great. Any allergies?
Thing that I know.
Okay, good. And are you aware if you are up to date with his immunizations?
Yes, he is. He's up to date.
Okay, that's good. Yeah. It's probably a good idea to just check with the GP as well at some point, just to make sure that everything else is up to date, especially because it's an incident where he may have potentially come in contact with certain bacteria or things from the soil.
Yes.
So just covering all bases at that point.
Sure, once he feels better.
Yeah, absolutely. Now, I have had a look at his teeth. So from the way these teeth have been injured today, one definitely looks like it has moved away from its position. The other one has just broken a little bit. A bit of it has chipped off. The good thing I would say that is there is no nerve that's been exposed in this case. So I do also have a question with regards to the broken bit. Do you have it anywhere with you?
No, I didn't realize that the always was missing. You want me to go back and look or ask his coaches?
That's all right. But you don't recall seeing it even at the time of the incident?
And until I had seen there was a bit deeply, like I was more worried to get him somewhere else, where someone can help him, and I didn't really. I just know that his teeth was there.
Yes.
I didn't really realize if a part of it was missing.
Right. Okay. So, as a part of our investigations today, the main thing there would be that I will have to just take a radiograph, which is a picture of the tooth, as well, just to see if the bit is lodged anywhere in there. We don't want that to be swallowed or be found in the teeth, and just checking to see if the nerve was responding or not. The one which has moved a little bit, that was not responding at all. And the one which is slightly broken, that one did have a very long response to cold. Again, these are all expected outcomes because the incident has only happened 30 minutes ago, right? So we cannot say anything definitively whether these teeth are completely damaged or they have a potential to heal. So we do need to give it some time to assess whether the nerve's going to recover by itself or not.
Okay.
So what we'll do today is for the one which is broken, we will just place a filling on top of it, and I'll clean around the area. We'll put a filling on top of it, and then we'll monitor it. Now the one which has moved a little bit away from its original position, I've taken some initial pictures as a reference to show that this is where it started and this is the final outcome. So we will move it back to its position gently, and we will also have to put a wire around it just to stabilize it.
Is this going to hurt him?
We will do our best to make sure that this is a comfortable experience. So what we'll do is we will have to numb him up a little bit and then continue with the procedure. Yeah.
The numbing also help him relieve his pain?
Absolutely, yes. It'll give him definitely a lot of relief for the next few hours at least. Once we do the procedure, we will then have a chat with you about what to expect from here. So for the time being, I would definitely suggest no more contact sports, because we definitely want him to have some time off and heal from this. Soft diet and any sort of pain relief that you have at home, you're more than welcome to use that. And in a case where you've started to notice that he has severe pain, fever, swelling, and if you're noticing that the teeth are changing color, that's when you have to come back and see us immediately.
Okay.
And in a case where it's say after hours and he's got severe swelling or anything like that, then you do have to see the emergency department. Okay.
Not very often the children trouble. It's just something extreme that you're saying.
Yes, absolutely. Yeah, these are things that we should always be prepared for. Now, with regards to the long-term options with these teeth, since we cannot predict the outcome of these teeth today at this point, I do have to tell you that there is a chance that the nerve may not recover. And if that was to happen, then these teeth will probably need what is called as a root canal treatment, which means that we go in there, remove the nerve, fill it up with material, and then we manage it long term. So that is the reason why we will be talking about the long-term management once we review you.
Okay.
Now, the review protocol would be that we'll see you now. I'll give you a call in 2 days' time first after today's treatment to see how you go. And we'll see you in 2 weeks.
Okay.
Now, in 2 weeks, two things can happen. The teeth might heal, they might show signs of healing, but sometimes they may still have the same response that we've had today. Regardless, we will do all investigations and examination on the day as well, and we will then take out that wire. If I'm happy with the movement and the way the tooth has been stabilized, we can take out that wire and then we'll continue to monitor it. But if I find that in today's x-ray the bone around the tooth is also slightly disturbed, then we will keep that wire on for another 2 weeks. So that would make it a total of 4 weeks.
Oh, can he eat anything if everything is going to be a problem because there's all?
It should be slightly uncomfortable, but it should not interfere with his function at all. Yeah. So we'll make sure that it's all cleaned up nicely, and he does need to maintain good oral hygiene in this meantime as well. And that's why I would advise soft diet. Yeah. And again, I'm just reiterating that mouth guards are very, very important. So we must make sure that you always wear a mouth guard. Yes, practice, main games, anything at all. You must wear them.
So you're saying like
There was a very good chance that this would have been avoided, yes.
I think he's yes.
I'm sorry to see you going through this, but it's one of those things where we do need to make sure that we're always following some preventative measures. Do you have any other questions for me, Ms. Smith?
Definitely going to work on for him because his full position has changed.
There's a good chance that we will have to. Yes, that's a good question. We do have to review this once we've stabilized the teeth and once there's healing. We will have to make sure that we get a new mouth guard made as well. Yes.
Also, he represents his schools at various forums. So do you think that this dent is going to be realized on hand problems with his appearance? It's because there's a lot of public speaking and he has one coming right next to me. It is very pumped for this.
Yeah. We'll make it as obscure as possible. We'll make sure that it does not stick out and interfere with his cosmetics. But it can be a bit tricky. Yeah.
Okay.
Any other questions for me, Miss Smith?
Okay.
All right. So should we go ahead and do the remaining
Definitely.
investigations? All right.